Good morning, everybody. Thank you so much for joining us for our third tribally centered training series about freshwater harmful algal bloom monitoring. Today, we're going to talk about public health coordination. So you're going to meet all of our partners that we coordinate with at the water boards to keep everyone up to date on what's happening with public health when HABs occur. For those that haven't met me yet, my name is Anna Holder. My pronouns are she, her. I work at the State Water Board, and I am our office's Open Data Science, Equity, and Tribal Coordinator, and I'm going to be your facilitator today, so you won't hear much more of me. But I'm not done yet. So this is the plan for today with approximate timings. We might go a little faster in some areas, a little bit slower in others. But we'll get you out of here by lunchtime for sure. As usual, we don't assume anyone has attended any of the previous trainings, so we're going to give you a quick recap of the critical stuff that we've covered from the past trainings to really ground us so we can all talk about the topics today and hopefully learn from one another as well. Excuse me. We'll have a break about an hour in. Again, stretch those legs, refill beverages, all that good stuff. And we're excited. So last time we met most of our regional board FHAB coordinators. Today, we're gonna get to match names and faces to folks in our Interagency Illness Response Task Force. So we're really excited to invite those folks into the space with us today and to give you time to ask them questions if that's something you want to do. As usual, we're in Zoom. We're going to be recording this meeting so we can get it posted online. For folks that wanted to join today but couldn't, they'll be able to access things. We'll also be posting the slides. But I just want to flag here if during discussions or if before you ask a question, you want us to pause the recording so you feel more comfortable asking your question or having a discussion, please let us know. You can do so in the chat or just vocalize before you start speaking. Happy to do that. We really want to make this space productive and useful for you. And if pausing the recording during discussion supports that, then we're happy to do that. So it's not, the discussion doesn't necessarily need to be posted publicly. Similarly, if you leave today and you go, actually, you know what, that discussion we had, I don't necessarily want that piece published after the fact, that's okay. Just shoot me an email and we can cut it out of the recording as well. So we just want to make sure that, you're feeling comfortable with sharing whatever it is you want to share, ask whatever you want to ask today. I don't see anyone on the phone, but in case you need to switch to the phone, running to meetings, I know that's a thing that many of us do. If you log back in, you can *6 to mute and unmute yourself and *9 to raise your hand. And folks should be able to unmute themselves and turn on your camera if you want to do that as you ask your questions vocally, or you can just pop them in the chat and I will ask them for you anonymously. Okay, Zoom controls. Your names in the participants list are just delightful. So you don't need to rename if you don't want to. But just to remind folks that there's the chat available at the bottom. We love a reaction if you're into giving those during presentations. And what else? Yeah, mute, unmute. You know how this works. You're all pros. Okay, we are going to kick things off with a poll just to get everyone warmed up. Everyone in the room with us is welcome to answer the poll if you want to. So I'm going to open the poll. The questions will come up on the screen. We have 2 questions today. You'll see them in a second. So you might need to scroll in order to see everything. You'll submit your answers, press submit, and we'll share the results and talk over them together. So the questions for today are, again, we're thinking about public health communication and coordination. We're going to share about what we do with the water boards and our other state agencies, but also thinking about how we can support tribal governments with the communications that you all have to do for your governments as well, and to keep your communities informed when HABs occur. So, what resources would be helpful for you, like that we could maybe create for you and hand off, and then you can use them to support your work? This one's a short answer, so whatever comes to mind is welcome. We have some examples here just to like get the juices flowing. So maybe, fact sheets about harmful algal blooms, language templates that you can, reuse and remix for your needs that you have on hand, physical signs to post at water bodies, and anything else that comes to mind. And then again, we're talking about communication and coordination today. So really wanting to think about how we can do better with coordinating and communicating with tribal governments. So what are the best ways in your mind for us to communicate with your teams, if that's something that you want from us, regarding public health announcements that we have at water bodies that you might be interested in? So we've got a couple of questions for you, or a couple of options: email updates, social media, website updates, press releases, meetings or webinars, and then other, whatever comes to mind for you. We've got a small but mighty group with us today. So I'm gonna and many of the folks in the room are part of our interagency illness work group team, so they might not be answering the questions. But I want to give another few seconds for folks to complete the poll if you want to. Okay. Great. Wonderful. Okay, I'm going to end the poll and share the results. They're going to pop up on your screen, but can't see them in the recording. So I'm going to talk through them. For the resources that would be helpful, actually, this is kind of cool. Maybe check that out. Handouts was a big one. Oh, actually, you know what? No, I'm going to change that. I will add the word cloud into the slides before, so people can see what came up for them. So we've got handouts being the biggest thing that folks wanted in terms of resources that would be helpful. We've also got templates, games, like games to help, for children, or engagement, social media, some equipment, yeah, and then informational templates, worksheets, things like that. Awesome. That is wonderful. We might be able to talk about some of the things that we already have ready to go, like handouts and informational fact sheets that we can share with folks today. But we can think about the other things, like fun games for kids to help keep them informed about harmful algal blooms and things like that. Okay, and then the next question was, what are the best ways we can communicate with your teams regarding harmful algal bloom public health announcements? 80% of folks that responded said email updates. After that was meetings and webinars. That's helpful to know. 60% of folks said that. 40% said social media, and 20% said web updates. So really getting the information to you through email, social media, meetings, and webinars. That's super helpful. If you have any other ideas, feel free to drop them in the chat, and we'll keep those on our minds too. Great. Okay, This is my favorite part when I get to stop talking and hand it over to our instructors. Um, we usually like to have a tribal instructor join us. We'll talk a little bit more about why that's not the case today later. Um, but in the meantime, I'm super excited to pass it off to the one and only Swamp FHAB Dream Team. The State Board, Carly Nielsen and Marissa Van Dyke. Go ahead and introduce yourselves and take it away.
Hi, good morning. My name is Marissa Van Dyke, and I'm one of the co-managers of the FHAB program that Anna just mentioned, and that stands for the Freshwater and Estuarine Harmful Algal Bloom Program. But we're going to use that term FHAB for short a lot today. And with that program, we are with Carly and I are housed in Sacramento at the State Water Board. We coordinate the program along with the regional water boards, FHAB coordinators statewide to primarily coordinate that event response and response to those HAB reports. And I'm going to hand that over to Carly and she can expand a little bit more as well. Thank you.
Hi there. So you'll be hearing from me as well later today, but I work alongside Marissa Van Dyke. We're the two leads in Sacramento, so we are a small but mighty team, we like to think. But as she said, we headline a lot of the incident response across the state, as well as develop a lot of research and tools and outreach materials, as well as participate in our interagency HAB-related illness work group. So we kind of have our hands in a little bit of everything.
All right. So we're going to begin with a quick recap from past trainings. This will help tie together how public health is addressed by the statewide voluntary guidance for HABs, specifically that coordination among responding entities and the communication that occurs. All right. So during the last training, we went over the California Cyanobacteria Harmful Algal Bloom Network, or CCAB networks, response guidance. This guidance was developed through an interdisciplinary group that participates in the California Water Quality Monitoring Council's subcommittee. And I realized that was a lot of organization. So I'm going to recap that this guidance was developed by the CCAB network, which is a work group under the Monitoring Council in California. So this guidance here, we've got a snapshot of it, presents an 8-step process for response, and it's a voluntary approach that's implemented statewide. So anyone can participate in the CCAB network as all meetings are public. And I'll give a quick recap of the statewide voluntary guidance here to set the stage for the rest of the material in this presentation. And again, this guidance, the voluntary, is the responding guidance that the FHAB program implements along with other participating state agencies. All right, so we're just going to skip ahead to step 3 of the 8-step process and really focus in on that coordination and communication piece that again set the stage. So let's bring you to the reporting. So first, to inform when to report a bloom, this guidance recommends surveilling a water body to identify any changing conditions and then report that potential HAB to us once present. And also with that reporting form, you can also submit any associated HAB illness that's suspected. And that can include illnesses to animals, fish and wildlife, humans, so forth. And then this diagram shows many other steps after that suspected HAB has been reported. We often receive HAB reports through, again, that online mechanism, also through emails and phone calls as well. And so when we get that report in, the FHAB coordinators at the water boards review and verify the materials that are submitted and initiate the rest of that the event response process. And that response process can include following up with the reporting party to get additional information, oftentimes site-specific conditions. And then the coordinators will also follow up with appropriate county personnel, water body managers, associate tribes to learn of the on-the-ground conditions and coordinate those next steps, which can include sample collection. And that's important to determine the toxicity or any toxin concentrations of that bloom. And with that, it informs public health advisory signage. And this is recommended to continue, that routine monitoring and sample collection during the duration of the bloom to inform any changes to the advisory signage, and then inform the deposting process down at the end of this diagram once the HAB dissipates. And today we're going to focus on the public health components that are in this diagram. So if we receive a report of potentially HAB-associated illness, that illness is investigated by an interagency HAB-related illness work group. It follows a separate process, and that's something we're going to get into much more detail later. All right, next slide. The response guidance provides a framework of trigger levels based off the cytotoxins and visual indicators of HABs to then trigger posting those recreational advisories. We discussed this in detail in the February training. I want to highlight that there are different cytotoxin trigger levels for 3 different cytotoxin classes, and then those correspond with differing recreational advisory recommendations that escalate as the concentrations of toxins increase. All right. So the framework for planktonic blooms include 3 tiers of escalating severity. And just as a reminder, we talk about 2 different kind of forms blooms can take in California with these harmful algal blooms. They can form planktonic blooms, also benthic blooms. So planktonic blooms are free-floating blooms in the water column. There's something easily visible from the water surface, in the water surface from the shorelines. Normally corresponds with like spilled paint, major discoloration, greenish, brown, and so forth from the shore. And so each tier of the signage here has different recreational advisory recommendations, focusing on protecting children and dogs, as well as drinking water from that waterway directly, and also eating of the fish and shellfish. So for example, the caution advisory, the lowest tier, recommends staying away from discolored water, and the danger advisory, the highest tier, that red border, recommends staying out of the water entirely. And so if you are interested in learning more about this, please visit our recording on the February training. It goes into it much more detail. All right, so the framework for benthic cyanobacteria blooms have different tiers of signage. As a reminder, benthic blooms are those that that are formed by algal mats. And oftentimes those are attached to rocks in the bottom substrate of rivers and creeks. And they can also persist in lakes as well, especially along the shallow shorelines or where UV can penetrate to the bottom. The framework presents 2 signs here. The one on the left is the general awareness sign, and it's recommended for areas that have had known benthic algal blooms historically or in areas that are not heavily monitored. So just to keep the public aware that benthic mats may be present. It's also posted oftentimes as a conservative approach when sampling shows that conditions are below the trigger levels, particularly recommended when there's no planned monitoring that will be taking place. So this sign recommends that in particular children stay away from any mat material and restricting dog access. And the toxic algae alert signage, this is when toxins are detected in the algal mats or the spatial coverage of the mats exceeds the trigger level based off of the framework that CCAB network developed. And this spatial coverage and the toxins analysis, that's dependent on the sampling procedures, and more information on sampling protocols are going to be provided at the May training of this training series. And again, this tier, the algae alert signage, has the same recommendations as the prior sign. You'll note that the warning is more explicit, stating that toxic algal mats are present in this water. And signage is also more visible with the yellow banner, and also corresponds with the planktonic framework's yellow signage. All right, so to close the loop on the 8-step process of response, once the HAB has been identified and appropriate signage has been posted, the CCAB network guidance recommends following up with monitoring on a bi-weekly schedule to visually monitor and collect samples for analysis. Those HABs and their toxin production can change rapidly. Then after 2 consecutive samples that are below the caution or the toxic algae alert trigger levels, the water body can be deposted. And we do recommend moving back to step 1, which is surveillance throughout the rest of the recreation season, just to keep an eye on the waterway. Okay, so that was our recap to get us all up to speed again from the previous trainings opportunities. So in today's training series, we're going to be focusing on public health, beginning with an overview of the routes of exposure, symptoms that people and animals may experience when exposed, and the primary toxins of concern from these algal blooms. All right, so harmful algal blooms, or HABs. They can occur in freshwater, estuarine environments, including those bays, and the near coastal waters and marine waters. And these HABs have many impacts to people and the environment that we categorize by their impairments, what we call beneficial waters, uses of water, and beneficial uses. So these impacts can include changing the physical conditions of waterways and the way it functions, primarily by negatively impacting other organisms, such as changing the food web, and also causing dissolved oxygen levels to drop and cause fish to die. And as mentioned, the bloom also degrades the aesthetics of the water body, right? Changes the color. It can be really unappealing and can also have odors. These blooms can also produce taste and odor compounds and also produce toxins that we're going to go into a little bit more today. Taken together, these impacts degrade a variety of uses, ranging from recreation to drinking water, tribal uses, fishing, including subsistence fishing, and also aquatic life. All right, so let's get into the routes of exposure. These harmful algal blooms can cause, you can become exposed to them in many different ways, in multiple pathways, sometimes occurring together. These routes of exposure include ingestion, both intentionally and also accidentally drinking the water or eating contaminated food. And I want to highlight that the CCF trigger levels are based on this type of exposure, which is it's just something that represents part of the routes of exposure that we're talking about today, and not all of them, unfortunately. So you can also become exposed by dermal contact, so that's skin contact when swimming, bathing, and also from boating spray. And you can also occur through get exposed through eye contact with exposure to contaminated water or aerosolized water from, again, boating activities and wind. And then exposure can also occur through inhalation of the aerosols that come from the spray and from wind as well. So many different ways to get exposed. And when it comes to HAB exposures, there are many different ways bloom can impact how Native peoples can be exposed to the health effects of these HABs. This conceptual model here was developed by the Big Band of Poma Indians and the Karuk tribe with assistance from 2 scientists several years ago. And it's really a great illustration of those potential impact pathways. And as noted on the slide, an individual's uses of water and exposures can be repetitive, gender assigned, and long-term. It may even occur secondhand through the use and trade of plants and animals that have been in contact with the harmful algal bloom. So in summary, HABs really isn't just a water quality concern, but it's also a health concern for all peoples. Our pets and livestock can also be impacted by harmful algal blooms. And the CCF network guidance includes precautions for them also in their signage recommendations and educational materials. So livestock and pets, particularly dogs, are exposed through their water sources like rivers, streams, and stock ponds, as well as through recreation with people when they are playing with people and splashing in the water. Some blooms that form mats, again, these benthic blooms, have odors that attract dogs and livestock, so they actually seek them out and eat them, causing an increased likelihood of being exposed because they're eating those mats and like the scummy material also that accumulates on the shoreline. All right, so I just discussed the pathways of exposure, but what are the impacts of getting exposed? So coming into contact with dense cyanobacteria blooms can also cause impacts such as skin irritation. When you get splashed also in your face, there can also be ear and eye infection and irritation. And when you ingest that water, it can cause gastrointestinal distress. And these concerns informs the lowest tier of the advisory signage in the CCAB network guidance, which is based on trigger level of visual indicators of a bloom presenting this hazard. So when toxins are detected, additional health impacts can occur. And again, there's those trigger levels that are cyanotoxin based in that guidance. Though it is important to remember with these cyanobacteria HABs that not all of them can produce toxins. So to determine if toxins are present in the bloom, samples must be analyzed in the laboratory to determine which toxins and what concentrations. Unfortunately, there isn't a method for us just to be able to visually discern if the bloom is producing toxins. And these impacts from these cyanotoxins are varied. They can impair the kidney and the liver and also impair the nervous system's functions. And I'm going to go over these in more detail in the upcoming slides. I'm going to give you a quick snapshot. And it's also important to note that these toxins don't only impact humans, but also domestic animals, our pets and livestock, and wildlife and fish as well. Specifically, these harmful algal blooms can alter the gill function and cause, of fish, and also cause disorientation in birds and wildlife. And severe cases of exposure to these toxins can also cause death, unfortunately. And then also going over, indirect impact. When these harmful algal blooms die off, they deplete the water column of oxygen, that dissolved oxygen, causing massive fish die-offs. It's another way that they can impact. So altogether, to prevent impacts, the guidance recommends avoiding water contact with the impacted water very entirely, if you can. All right. So let's dive into these different cyanotoxins produced by specifically blooms that are formed by cyanobacteria themselves. Then we'll go into some other forms of blooms as well. So these toxins have unusual names, and they're often grouped by their impairment, like a liver and kidney toxin or a neurotoxin, which is how we're presenting them today. These have, again, very unusual names, which I'll pronounce for you. So microsubstance at the top here is a class of liver toxins, which causes the liver to bleed out, and there are many different variants of this toxin which forms a class that's called microsubstance. So oftentimes with lab analysis methods or lab reports, you'll see it's reporting the class of microsubstance. And that's important to note for lab testing, which we'll get into later. So microsubstance is the most well-researched cyanotoxin. It's quite common globally. There's a lot of materials on this. You might be familiar with the cyanobacteria called Microcystis, which is a microcystin, the toxin producer. And yes, those names are not a coincidence. So we often see this toxin in the Delta and also in small lakes and reservoirs in the state. And Clear Lake in the county called Lake County is also renowned for its microcystis blooms. The toxin microcystins causes abdominal pain, nausea, vomiting, headache, diarrhea, sore throat, also can cause blistering around the mouth and pneumonia, quite a range of symptoms. Cylindrospermopsin is another toxin, and this toxin causes liver and kidney damage. And this toxin is less commonly detected in California waterways, but it is common nationally. So there's quite a few materials and guidance regarding cylindrospermopsin as well. Those symptoms also include, gastrointestinal distress, so vomiting, bloody diarrhea, as well as fevers and headaches as well. Both of these toxins have symptoms beginning within like the first few hours of exposure and to days after exposure. And their duration and severity is really based off the sensitivity of the individual and the amount that you're exposed to. The symptoms are important when we get into illness tracking information as well. All right, continuing on with these cyanotoxins. Now we're going to focus on the group of neurotoxins, and these are much more alarming as they cause symptoms within minutes. Local managers first began documenting suspected dog deaths associated with neurotoxins and mats, these algal mats the cyanobacteria can produce, and urban park lakes in the early 2010s. And more recently, the illness work group has had dog deaths reported to us from suspected exposure from these mats as well in rivers and streams, primarily in Northern California. So anatoxin A is here up at the top, and it's a group of toxins referred to as the very fast death factor. That's not a name that we place on them, but that's the group of toxins that they belong to. And as mentioned, dogs are particularly vulnerable to exposure. They can also seek out this material because it smells interesting to them. But children also recreate in similar areas as dogs and play with the mat material found on the shoreline, also floating by them. So anatoxin A, its mechanism of action, unfortunately, rapidly disrupts muscle function. So dogs may act disoriented, salivate, have seizures, and ultimately lead to death. Recovery from this exposure to this toxin is rare. Second neurotoxin to note is called saxitoxin. And it is less understood in freshwater systems, but it is also a marine shellfish toxin, commonly causing the paralytic shellfish poisoning. And we've only seen the saxitoxin here in freshwater systems in trace amounts. It's isolated predominantly to benthic cyanobacteria mats. And it also has a similar mechanism of action as endotoxin A, again, this group of neurotoxins. All right, so let's take a moment and also focus on marine HAB toxins. So I just went over these freshwater cyanobacteria toxins. Again, for freshwater, we're speaking to blooms that can occur in streams and rivers and creeks and reservoirs and lakes. So again, these freshwater systems. And that's primarily our focus of the FHAB program. But we also want to briefly highlight marine blooms to give you a comprehensive outlook of how HABs can impact the peoples in California and also then inform those downstream illness tracking procedures and how you may be communicated with. All right, so for marine blooms, these are produced by other algal species, so not cyanobacteria, and also they can produce toxins as well. You may be familiar now in the coastal waterways with brown or red tides. So these can be produced by marine algal species, oftentimes called diatoms. So this is a group of algae. They're called diatoms or in the phytoplankton community. It's quite broad. So diatoms, when they produce these toxins, they can cause amnesic shellfish poisoning. And this is referring to the condition called amnesia. So again, it's amnesic shellfish poisoning. Or it can also be called domoic acid poisoning in the news in reference to marine mammal strandings on the coastlines. Something, again, you might read in the newspapers. Most exposure is from consuming contaminated shellfish. And although we do get reports from the public of dermal impacts due to exposure by swimming and surfing, this is something that is covered also by the illness tracking as well. And I want to highlight that monitoring for shellfish toxin poisoning is conducted through a partner agency. So again, the FHAB program does not take lead on that monitoring. Rather, that partner agency that takes lead is the California Department of Public Health in coordination with the Department of Fish and Wildlife, and several other state agencies. And altogether, their efforts manage the fisheries quarantines to prevent exposure to contaminated foods. So again, that's the shellfish harvesting, both from commercial mechanisms and also from recreational mechanisms as well, again, in our coastal waterways. All right, so a secondary group of algae that produce toxins, again, in these marine environments, are dinoflagellates. And once again, these can produce brown or red tides, but also the bioluminescence. So sometimes there's reports of some really cool looking waters. Bioluminescence can have some pretty colors on the shore, especially when the surf breaks. And a lot of folks are attracted to go check that out. So as mentioned in the previous slide, these are produced again by marine HAB species, particularly dinoflagellates. And these can produce paralytic shellfish poisoning, and that's a neurological impairment. So again, going back to those neurotoxins, but again, these are not produced by cyanobacteria. They can also produce symptoms referred to as diuretic shellfish poisoning, and that causes then that gastrointestinal impairment, so that GI distress. I'm not going to go into the specifics of all the different species of algae or dinoflagellates that can cause these poisonings, but they are provided here on the slide for future reference, as many of our slides are provided as handy reference material down the line if you need to reference them in the future. Exposure routes is similar to the diatom scenario by consuming contaminated shellfish, but you can also be exposed dermally from your skin contact, again, swimming, surfing, and also you can be exposed here by inhalation of contaminated water spray. So again, from the surf breaking, the water spray from there, and from wind coming off the coastal waters as well. Okay, so in summary, we've reviewed a lot of material with that recap, and then going into a multitude of exposure pathways of algal blooms, also their toxins and potential symptoms from freshwater cyanobacteria blooms, and then most recently the marine blooms. And we really welcome your questions and feedback to this material. And we'll be taking a break after the question section. But we'll pause here for questions. Thank you.
They don't have questions about all those toxins that have funny names that I can never pronounce correctly.
Actually, I have a question about the ocean algae blooms. So you said the fluorescence that people see that they think, oh, it's really pretty, is actually a toxin.
Oh, sorry, I didn't catch the last words that you said. The pretty bioluminescence.
The bioluminescence that people see when, it's very exciting. Oh my goodness, come look. And yet what you're saying is what you're really seeing is the presence of a toxin that isn't as though beautiful, as safe as one might think.
Oh yeah. So thanks for that question. So the coloration, it comes from those algae that are in the water. Yeah, thanks for going back to that. They're called the algae is a group of dinoflagellates, and so it's the algae that's giving off that color, but not the toxins. The toxins are something that we can't see, and that's why we need to collect water and have it analyzed in the laboratory and learn if there are toxins in the water.
So if I'm understanding correctly, does that mean that not all bioluminescence experiences contain toxin and we don't know unless we test it? Or can we say, no, every time we see bioluminescence, we know a toxin is present? I think which one is it?
Yeah, so we know that there's this marine bloom occurring, and generally, from our response process, we recommend folks stay out of contact with water that has these marine blooms. So
and that's because we don't know for sure. Is that right?
Yeah. That's right.
Okay.
Right.
So this is Dave Karen. Just so you know, the vast majority of bioluminescent events that we get are with a relatively benign organism called Lingulidinium. That's where you really get you see surfers who are going through the waves and they've got wonderful color. If there were enough Alexandrium present to have visible bioluminescence, basically everything would be dead. They typically are toxic at very low concentrations. So there's no correlation really between the bioluminescence and the presence of toxins. There's also no proof if you have bioluminescence that there isn't some toxin present. But the Lingulidinium, it does produce a very strange toxin that it sort of comes in and out of vogue. People think it might be important, but it might not be. The biggest issue with Lingulidinium blooms is they reach such high abundances that when they die, their decomposition by bacteria can use the oxygen in the water and called anoxic events. That's really the
Mhm.
biggest problem.
Right, right.
Thanks, David.
So
Thank
what
you.
you're
Yeah.
summarizing is a major water quality concern as well. Go ahead, Anna.
Oh, I just thanks David for his contribution. Yeah,
Yeah,
Becky.
thanks, Steve.
Oh, I thought I saw a hand raised.
Hi, this is Shannon from Moweha. Can you hear me okay?
Oh, yeah,
Okay,
not Becky.
great.
I'm going to rename you.
Very good. Hello, everyone. Yeah, so again, with the dinoflagellates, they can have a bloom that doesn't necessarily produce a toxin, but they can produce some irritating compounds that can cause kind of what you'd experience with a cold, or if you accidentally ingest some of it, like if you're surfing or get hit by a wave or you're out swimming in the water and there is a red tide happening with this certain types of dinoflagellates, like we've experienced with some of our surfers, they can report irritated eyes, a cough that might last for a couple days, and then sometimes some gastrointestinal issues, whether it be, cramping with the stomach, particularly with salt water as well. But just because a toxin, it may not be present, it certainly can still cause irritation when in contact with sensitive tissues like your GI tract, eyes, nose, throat, etc. And that's typically what we see when it's a water contact with marine waters, like in our surfers. Thanks.
I think it would be really great if you guys could put together a bit more information about all of that in a simpler form, because oftentimes people don't think about oceanic contacts as having a contaminant because there's this underlying thought, it's got salt, right? Therefore, we don't have to be as concerned about it. Yet, as somebody who works with tribes, whenever we go, I do a lot of community outreach. We go to the beaches, we walk along the beaches, we gather seaweed. It's really for a tribe like Caddo, which is a traditionally a multi-habitat resource gathering community and traveling community, though we're in Lynn by 101. The history is to go to the coast, and there's so many other coastal groups, but yet we don't have the scientific knowledge and background about what's going on in the ocean waters. So I'll take my elders out there once a month, and everyone will get in without an understanding or recognition of what it is I might be bringing them to or their youth, and really would love to be able to better inform the community, do a presentation on it, and share the information about what it is we're seeing, smelling, or what could be creating the effect, the mast dial. I know that when I first started working here, there was so many questions about why all the starfish died, what happened to the sun starfish, what's going on in the oceans. Just do a lot of research to put that together. So it's really, really an important topic. And for me, as somebody who does bring people forward on that, being able to go out there and give good guidance matters, especially if I've got somebody who cuts their foot or wants to just sit in the water and just enjoy it. That's It's so wonderful to go to the ocean. It's so wonderful to be able to connect with nature, but being able to do it safely, especially in today's changing climates and human impacts, is really important. So thank you so much for talking about that, because it's not always the first thing you think about. And I know I've done a lot with the freshwater, but not so much with the ocean. So I really appreciate that.
Yeah,
That's
really
such great
appreciate it.
feedback, Anira. Oh, sorry, Marissa. Go
No, I
ahead.
was just also saying I appreciate your feedback. I had one follow-up question, if I can ask, Anira.
Sure.
Yeah, just to better understand the exposures, pathway, and check and see if the fact sheets that we do already have developed about marine HABs, if they would be appropriate. Can you clarify? You said that there's a lot of seaweed collection, so I'm taking it folks go into the water, collect seaweed. They may be also just kind of hanging out, waiting in the water, and also do they collect seaweed also from like the shore that's already kind of probably from overnight collected on the shore as well in the sand, or is it all like out in the water?
So
a combination of both.
Everyone's a little bit different, right?
Okay.
The older
Okay.
tribal members do all of the above.
Okay.
The
Yeah.
younger tribal members are really more just towards what's being collected on the rocks or fresher as they're learning. But I go to the ocean at least once a week,
Okay.
personally, and spend time out there with my family. I'm pretty heavily into nature, movie, theater, or nature. It's always going to be nature.
Yeah.
That's wonderful.
So I see a lot of different things. I personally don't like to just randomly eat dried things off the ocean beach. But and what is a traditional practice? I would say would be to gather the resources, bring them in a mesh net or a bag or however they're gathered, or by hand. And the tribal members, we will rinse everything and then put it back into the collection bag. So we'll take it, gather, rinse it, clean it in the ocean, right? With the understanding that we're preserving some of the, ocean as a mineral resource and salt resource traditionally is part of the culture that we're practicing. And it's really important, to really learn about those traditions. So the concept of bringing it home and then washing it in tap water defeats a lot of what is traditional practice. If we have enough time on a really warm day, we will actually lay sheets out on the sand and dry direct from gathering, right? And if they find other resources that are of interest, they may gather that or drink some of the ocean water. So, it's just this huge connection and celebration of the ocean, so all of the above.
Okay, your information is helpful.
Yeah, that's really helpful just to understand the exposure and how we can tailor any fact sheets that we do make to really satisfy that need. Shannon, our OEHA friends added links to the fact sheets that exist in the chat. I think they might be like pretty technical, so I'd love, you and I are connected in other ways too. So if you can check that out and let us know like if that works for you or if something different would be better. It doesn't have to be today. I'd love to make sure we bring a team together to really get what you're looking for available.
Oh, no, I would love that, because one of the things I'm finding is that I will go out and look at those resources and then spend time streamlining them. But because of my lack of knowledge that you guys have right here, everything's just been great. May leave out things that are of importance, right?
Yeah.
Or misrepresent information. I think it's really important when you're creating a fact sheet, it's facts.
Yeah. In plain language that anyone can understand. I have to think about, trying to talk about marine HABs like with my dentist, they have their own technical expertise, but they speak plain language and they're telling me about my teeth and I want to speak plain language when I'm telling them about cyanotoxins. Yes. So we have the links in the chat. The chats, as we log off, it's going to go away. I will pull those and put them as a backup slide in the slide deck. So we'll be able to reference them after as well.
I have copied the links, but they did not work for me because I was going to go directly to them as soon as I saw them. I was hoping somebody would do that, so thank you very much. But they didn't work as hyperlinks. They did not pull up the website. So I'm trying to copy and paste them, but for some reason they're just not reacting.
Yeah, Zoom is super particular about links sometimes. So it's not you. This happens to me all the time also.
Yeah, so I take screenshots and then I type them in later.
Yeah, for sure.
Yeah.
Any other questions or comments about marine HABs, freshwater, cyanotoxins, anything that we've gone over so far? Okay. Wonderful. We're a little bit early on our time. So do people want to feel good about taking a 15-minute break now? Do we want to push through a little bit longer? We're only about I think 10 minutes early. Breaks are good.
Yeah, Anna, if I can add one thing.
Yeah.
Yeah, sorry. I just realized I got a message about this conversation that we had, and I just wanted to give a quick recap. So, we talked about these bioluminescent blooms and so that, there's maybe less risk in general without testing. There are still some, impacts to respiratory systems and also from the splashing. So just a conservative approach that we recommend staying out of contact with water that may be impacted by a bloom, and learn more if it is safe from water testing. And thank you everyone for your input on this. It's a complicated subject, as is most topics when it comes to harmful algal blooms, and appreciate everyone's patience as we go through this material.
Yeah, lots of nuance. Thanks.
Yes.
Thanks, Marissa. Thanks, team. All right, let's pause. I'm a fan of breaks. So no one said keep on trucking. So we're going to take a break. Why don't we come back at 10:05? I'll update the slide. You're welcome to hang in the Zoom and just cameras off, things like that. But we'll see you back here in 15 minutes. Welcome back from the break, all. We are going to dive right back in. So before the break, we talked a little bit about the different routes of exposure some might experience when harmful algal bloom is present, and some symptoms that could arise that cause illness. This afternoon, we're going to talk about how, when that information is shared with us, how we can use it to keep track of what's happening, what's dangerous, what's safe, and how we can communicate that to the public. But as you all know, I'm not the expert here. So I'm going to pass it over to Carly, who's going to take us through our illness tracking process.
Yeah, absolutely. Thank you. So before I go to that, I just have a spoiler alert. There was a lot of questions about marine blooms and how to best protect yourself. And I just want to highlight that in the next training series 4, we're going to be going over some of our tools that we developed through remote sensing to help you do some at home sort of identifying if there may or may not be a HAB present. So it's a great screening tool to help educate yourself before you go out to certain areas. So if you want to learn more, come to the next training. And with that, I'm going to go directly into our HAB-related illness tracking. So I'm going to go over how these events of illnesses are tracked and how we can address these health concerns. Next slide. So in the response process diagram that Marissa showed earlier, we really highlighted that we receive HAB illness reports and how we initiate a separate investigation pathway. So you saw the investigation pathway for the signage, but we also have a different pathway when we get those illness reports to us. And this involves an interagency HAB-related work group consisting of staff from the water boards, which is Marissa and I in the FHAB program, Department of Fish and Wildlife, the Office of Environmental Health and Hazard Assessment, and the Department of Public Health. And they're going to introduce themselves in a few moments, so you'll get an opportunity to put a face to an agency. So I just want to highlight that each agency has specialized experience to aid in these investigations. So this includes a public health perspective, toxicological and fish and wildlife expertise, and then our support to the water boards with the water quality monitoring and the interagency coordination to facilitate that public health signage and public messaging. So the investigations include in interviewing reporting parties, reviewing medical or animal vet records, collecting and interpreting environmental data, and then discussions amongst our group collectively as to the evidence and symptoms to make a final determination as to if it's associated with the HAB exposure, that illness, or if we believe it might be a separate incident, or if we just don't have enough information to make that determination. Next slide. So this is similar to the last slide, but just as mentioned, we receive reports of illnesses and we gather more information to inform the case. We get those reports either from our online reporting system, or we get it from poison control. So based on the evidence and data, the illness work group makes final determinations as to a HAB-associated illness is suspected. And if we do think that it is suspected that it's HAB-related, we report it to the Center of Disease Control and Prevention's database for national tracking. We also track ourselves and publish our report tracking outcomes annually on the California HABs portal to document our statewide information. And why do we track all of this? Well, it's really important to better understand the extent and the trends of this health issue and to really elevate it nationally and even at the state level to get more resources so we can be more proactive in protecting folks from potential exposure. Next slide, please. So this is a good timeline here for you. You can see that it's really, really long, but just highlighting that these investigations can be lengthy and time intensive. So it's really important to have really great coordination to ensure that adequate and timely information collection. So this timeline shows that an investigation can take from weeks to months. And as I kind of alluded to before, in some cases, we aren't actually able to gather the pertinent information to inform a final determination if an illness is HAB associated. So some of the constraints we encounter often is the reporting party just may not be responsive to outreach by our illness work group to gather additional details as to the location of the exposure, which may cause missing an appropriate window to actually go out to that location and collect a water sample to understand the environmental conditions at near the time of exposure. And environmental samples are really important to be collected because it helps us determine if a HAB is present, to confirm if that is the type of exposure. And that's oftentimes the largest piece of evidence we do have. So that rapid field investigation and sample collection is really necessary to get out there within a day or two from that exposure. And it can be challenging when you have limited statewide resources, as well as limited local volunteers that might go out and do the sampling for you, because in some cases we just can't get out there in time. This graphic also highlights the biospecimen sampling and analysis, but I want to highlight this collection of samples is really rare in our state. There's limited lab capabilities to analyze these biological specimens, and they also must be fresh, not degraded. So this really makes that environmental sampling and the interviews to learn of symptoms some of the most important lines of evidence we have to inform our investigations. So what has this illness tracking yielded? So these are some of our visuals and these are also on our HAB portal as well, if you want to go and reference that, but they're just an example of our illness work group state reporting and tracking information. So based on the illness reports we received from 2018 to 2019, we're seeing that HABs really aren't isolated to certain times of year. While there are peaks during the summer months, HABs are really occurring year round. So it is becoming a persistent problem for us. And then additionally, proactive monitoring prior to peak water recreation, like summer holiday weekends, really helps inform recreational hazards and advisories. For our FHAB program, we actually prioritize what we call pre-holiday assessments. We went over that in a previous training, but it's where we partner with different folks that can go out and do monitoring before those big holiday weekends so that we can get that information out to the public as to what waterways are safe to recreate. And as you can see here from this bar graph, it really is valuable information in trying to protect folks from those potential exposures. And then the map on the right demonstrates that HAB illnesses aren't isolated to certain areas of the state. So you can see from this map, we have reports almost in every county. The northeastern part, unfortunately, has a little less information, and we don't suspect that's because we're not having illnesses in that area. We think that just because it's so rural that we've maybe need to invest a little bit more in outreach to that area so folks are informed of HABs and how to report them to us. So this graphic shows that most HAB reports submitted to our system actually are just of HAB reports and they're not of associated illness complaints. but the public are still sending them in the hundreds each year. And so approximately 14% of the reports that we get to our program include illnesses, and that could be either impacting people, domestic animals, or wildlife. So it is a problem we see in our state, and that's been one of the main drivers of us having this interagency work groups so that we can really address this issue. So the tracking by the illness work group also results in reporting nationally to the Center of Disease Control's database called OHABs for short. And this voluntary reporting is available to state, local, tribal, and territorial health agencies. And they've been collecting reported data since 2016, and they publish national summaries around every 3 to 5 years. I do want to highlight that only 15 states are reporting to this national database. This was in 2022. So additional reporting by health agencies would better characterize this public health concern at the national level. And they also only collect specific information, which is why we actually independently track and report on our HAB-related illnesses at the California HABs portal, and as well as for the marine illnesses on the OEHA's web page. So we make sure that we're collecting our own metrics so that we can better characterize at the statewide level. And with that, and without further ado, I want to actually give you an opportunity to meet some of the folks that participate in the illness work group, and then some other state agencies, folks that address HABs at the statewide level. So next slide. So this is just a quick introductory slide. And just to kind of reorient folks that are our different members and what we do. So once again, we investigate potential illnesses to humans, domestic animals, and fish and wildlife. And it's multidisciplinary because we have different expertise. So that way we can actually adequately and use our collective expertise to deal with these different range of illnesses with different animals and people and domestic animals. And then, although not a participant in our illness work group, we invited the Water Board's Division of Drinking Water to introduce themselves today, as they collaborate really often with our FHAB program for HAB incident response, and they provide protections from exposure to HABs from drinking water. And I know that's a concern for folks. So we just wanted to give them an opportunity to put a face to their program as well. So without further ado, I'm going to introduce ourselves because we're easiest and I'm already here. And then I'll segue to everyone else. So the FHAB program leads the environmental investigations for HAB reported incidents. We follow our internal HAB incident response process. And Marissa mentioned that earlier, but if you want to go back and learn more, please, I encourage you to rewatch the Course 2 presentation. And through that process, we notify relevant parties, including the county, water body manager, and associated tribes that a HAB is present and then an illness was reported to us. And that's to, one, let them know, and two, oftentimes to solicit their help to get out and get some of that environmental data, as I mentioned before. And so then we coordinate or we conduct the sample collection, and then we help interpret the results to inform that public health advisory signage, and as well as to inform the illness investigations as to what that environmental data is telling us. And as I said, Marissa and I are the faces to that because we manage the FHAB statewide program. So we're going to be your water board leads in that component. And then I'm going to pass it off to the Division of Drinking Water next, and they're going to just give you a quick, will introduce themselves, their agency, and then an overview of how they intersect with the FHAB program or participate in the illness work group, and as well as any resources they might have that might be helpful. So you've heard a lot from me, so I'm going to go ahead and pass it on to Stefan Kahina, who works in our Division of Drinking Water and was kind enough to lend us some time today to join us. So Stefan, I'll pass it on to you.
Yeah, thank you, Carly. Really happy to be here. Again, my name is Stefan Kahina, and I manage the Division of Drinking Water's North Coastal section, which is kind of from the greater Bay Area on northwards through Mendocino County. It includes Clear Lake, so that's probably why I'm kind of involved in HABs in the first place. So the Division of Drinking Water leads the response to any impact to drinking water at public water systems. And that part's important because we only regulate public water systems, which are water systems that serve at least 15 connections or 25 individuals So anything smaller than that, we don't have authority to regulate it. And speaking of regulation, cyanotoxins are not regulated in drinking water at either the federal or state level. So we don't have maximum contaminant levels or enforceable limits on them. There are, however, federal health advisories for two types of toxins, microcystins and cylindrospermopsin. So those health advisories, although they're not enforceable, they give us some idea of levels that could be a threat to health in drinking water. Kind of similarly, this year, the Division of Drinking Water plans to adopt notification and response levels for microcystins and cylindrospermopsin, which have federal health advisories, and also two additional toxins, anatoxin A and saxitoxin, which we've heard some about today, because all of these show up in California's water bodies. So notification and response levels are a thing that the state can do, like the federal health advisories. They're not enforceable limits, but they are numbers, and they don't require water systems to monitor. But when water systems do monitor voluntarily, which a lot of them do, these numbers will give us some idea how to assess their results for any potential health threat, and will allow us to make some recommendations, like should they notify their governing body, should they be looking at removing that source from service, and so on. So if we don't have enforceable regulations for these toxins, what can we do as a regulatory program? Well, number one, we do work closely with water systems, and we provide them technical assistance in a lot of areas, and we strongly recommend that vulnerable systems develop cyanotoxin management plans. There's a lot of guidance available for doing that. We recommend they assess the vulnerability of their sources and that they monitor when blooms are present. And we've worked closely with a lot of water systems in getting good plans together. Again, Clear Lake being our biggest example of that. We engage not just with the water systems, but with other agencies and sometimes with tribes to provide technical assistance, and to address health concerns around algal blooms when they come up. And so that's probably the main way that we interact with the rest of the water board's FHAB programs. A lot of times they become aware of a bloom in a water body that could affect drinking water sources. They let us know, and we get involved in the investigation at that point. And if there are water systems that need to be advised or that should be doing something to respond, we work closely with them. It's all based on recommendations at this point, not requirements, but in the drinking water community, most folks want to do the right thing to protect their consumers. One thing I want to point out, when it comes to tribes, is that we and the drinking water community have really benefited from the work of tribes in dealing with harmful algal blooms in some situations. And a good example of that is the work that Big Valley Band of Pomo Indians and Elam Indian Colony at Clear Lake have done. They've really led the way in terms of the monitoring efforts in that water body for many years, and have traditionally made those data available to the entire community. So that, for the water systems around that water body, really becomes a whole part of their vulnerability assessment and monitoring strategy. So, it's a case, not of us doing anything to help those tribes necessarily, but of those tribes being, tremendously valuable partners in helping the whole community deal with that threat and that severely impacted water body. Now, the Division of Drinking Water does not regulate tribal water systems. We're one government; those are another government. So we don't have regulatory authority. We have relationships sometimes, and our staff is available to discuss drinking water regulations and standards when tribes are interested, and to provide what technical assistance we can in understanding these impacts and how they can affect drinking water sources, including, pointing the way towards recommendations around water treatment or collaboration with nearby public water systems when that is needed. So I was just going to end on what I hope is a positive note. The monitoring that we have around the state to date has shown almost no presence of cyanotoxins in treated water at public water systems. That means that the treatment processes that are in place at these systems can do a good job of removing toxins, and we've certainly had the chance to confirm that at Clear Lake a number of times over the years. But I want to point out our data is limited, so we shouldn't be too comfortable about it. Surface water treatment systems can remove toxins, but they have to be the right kind of system. They have to be operated optimally and supported by a good monitoring program. And those are all things that we're happy to discuss with anybody who's interested. So that's about it for us, I think. And yeah, thanks a lot for having me.
Yeah, and I'll just pause here to note that if folks have questions for Stefan or the others that we're going to be introduced to next, feel free to add them to the chat. We'll have a Q&A with the whole crew after everyone has introduced themselves.
Yeah, and I just want to say thank you, Stefan. They're a great program to collaborate with. FHAB does it often, especially when we have a HAB in a potential drinking water system or lake or reservoir. And so, yeah, if you have questions or concerns, or especially if you have some of those smaller systems, they are a great resource to tap. Next up, I'm going to introduce our Department of Public Health partner who works with us at the Interagency HAB-Related Illness Work Group, Thomas Hayashi. So Thomas, I'm gonna let you take it away if you don't mind.
Sounds great. Thanks, Carly. Yeah, thank you folks for giving me the opportunity to introduce myself today. My name is Thomas Hayashi. I'm an environmental epidemiologist here at the California Department of Public Health. I represent CDPH here at the Harmful Algal Bloom Illness Work Group, and I primarily investigate any human-related harmful algal bloom exposures. I work in collaboration with the Illness Work Group, and we kind of pairing all the environmental information as well as any interview information that I may glean from the human illnesses. We can then get our case determinations. I do want to also mention that I work in collaboration with OEHA in regards to the Office of Environmental Health Hazard Assessment in regards to any human illnesses. They often will support my cases as we are investigating them. I do want to also mention here that as listed in the responsibilities below, I also work in association with the CDC OHABs program, so the One Health Harmful Algal Bloom System, where we track at the national level, the CDC tracks human illnesses and any impacts we have from harmful algal blooms generally. So any cases that we've determined to be harmful algal bloom related, we then will feed into that CDC database. I do appreciate Stefan mentioning the Big Valley Band of Pomo Indians. I also have the great benefit of working in collaboration with them as well through a CalWatch or through Tracking California program, where I basically work in support alongside Becky from OEHA. I work in support to their program where they're trying to essentially determine the freshwater pull impact. So the people that pull from Clear Lake, kind of the impact that they have on their drinking water systems in regards to pulling from the lake. And so they survey a lot of those folks, and we just kind of work in collaboration and support of the Cal Tracking Group. So that the Cal Tracking Group works alongside the Big Valley Band of Pomo Indians as well. So yeah, they do some fantastic work. So I'm glad that they got a shout out as well. And I also want to mention that the CDPH as well as OEHA work in regards to tracking the harmful algal bloom marine illnesses, human illnesses as well. And so yeah, I think that pretty much briefly covers some of the work that I do here at the California Department of Public Health and in collaboration with the Harmful Algal Bloom Illness Work Group. Feel free to, my contact information is listed, so feel free to reach out if you have any additional questions, or feel free to message in the chat as well. Thank you again for the opportunity to introduce myself here, and great job, everyone, Anna, Marissa, and Carly. Thank you.
Yeah, thank you, Thomas. We appreciate you coming today. And Thomas is awesome. So if you guys do have any questions for CDPH, he's an awesome resource, and I encourage you to tap it.
And I'll just get you prepared now, Thomas. I'm going to ask you about the grant funding opportunities during the Q&A. So just to share more details about that, that tribes can tap into. So get ready. Okay, thanks.
Okay, and next, it's my pleasure to introduce Shannon Murphy and Becky Stanton. They work in the Office of Environmental Health and Hazard Assessment, and they also are participants in our HAB-related illness work group that we have talked a lot about earlier. So with that further ado, once again, I will let them take it away and share about themselves.
Thank you so much, Carly, and it's a pleasure to be here with all of you. My name is Shannon Murphy, and I'm a toxicologist with OWEHA, that's Cali, PA's health agency, and we work to support and expand FHAB programs, awesome resources and their messaging, and help to amplify those opportunities where we can collaborate. But namely, we serve on the illness work group as one of the health agencies along with CDPH. Like Thomas said, we support in the human investigations, and then we serve as primary lead on domestic animal HAB associated investigations, which of course may include dogs as some of our primary, but also could be livestock. Cattle we know are also susceptible to cyanoHABs in freshwater systems. So we serve as one of the reporting agencies along with CDPH to OHABs. So those cases that are determined by the illness work group to be HAB related get reported to the national database. And then also we help to support the tracking for the state of California. As Carly noted, we also keep our own data for our state efforts as well. We are, work in collaboration on the marine side. So as Thomas mentioned, we help support the marine human related illnesses, seafood related illnesses, and I'll hand it over to my colleague Becky in just a second. I wanted to also note that OWEHA does develop the notification levels that are the health advisory levels for those chemicals such as cyanotoxins that aren't formally regulated. So that helps to support the efforts of the Division of Drinking Water over at the Water Board and all the great work they do. Also, another program of OWEHA's that may be of interest to the tribes at large is our Climate Indicators program, which also has a subsection on marine HABs, but really takes a broader perspective on all the different factors that may be impacting tribes throughout the state as our climate is undergoing significant changes. As far as our resources, we have, of course, the freshwater and estuarine HAB illness tracking and marine HAB illness tracking pages. Those are available in English and Spanish, and they have one-page fact sheets that are helpful to distribute at tabling events and things of that nature. And with that, I'll hand it over to my colleague, Becky, who will talk more about our engagements on the marine side. Thank you.
Great. I'm Becky Stanton. I'm also a toxicologist with OWEHA. As Shannon mentioned, on the marine side, we work in collaboration with additional programs at CDPH in their environmental management branch and the food and drug branch, particularly related to domoic acid in seafood, in terms of recreational and commercial fisheries. And we have made recommendations to CFW to take fishery-related actions for those toxins in seafood. We also work with the marine animal rescue centers to help document and track marine animal impacts, particularly California sea lions are one that have been predominantly impacted. And then we've also worked with our Karen on other aspects of our marine animal tracking. So really appreciate the collaborations through this program. So we the marine monitoring also has partners with, it's called the California HAB map, and I know of Dave Karen is involved with that as well. So I'm sure he could speak more to that program. So we really leverage a lot of different partnerships also on the marine side in our efforts in those arenas as well. So thank you.
Awesome. Thank you so much. I appreciate you guys going over the marine in a little more detail because I know there was a lot of interest on that earlier. So thank you for being thorough and the fact that you guys, and same with CDPH, that you address both freshwater and marine illnesses. And last but certainly not least, our last partner is the Department of Fish and Wildlife, Karen Atkins, and she leads a lot of the investigations with the fish and wildlife illnesses and deaths we have across the state. So Karen, I will let you take it away.
Hi, everyone. Thanks for having me. Karen Odkins here. My pronouns are she, her, and I'm a senior environmental scientist specialist over at the California Department of Fish and Wildlife. I am also with the statewide freshwater and estuarine harmful algae bloom program, or FHAB program. So as was mentioned before, there are lots of HAB-related mortalities and illnesses in fish and wildlife, mammals, birds, shellfish, crustaceans around the state every year. We see some large-scale mortality events, usually with fish, but also lots of other things. So it is a big concern. My job at the illness work group, or in relation to the illness work group, is to lead those fish and wildlife mortality and illness events and the various activities around that. So as part of that, I conduct the interviews with reporting parties and talk to water body managers that may have been around to see what went on in those areas and witness some of those illnesses and then deaths in some cases. And then I also help with the surveying that may occur after those to try to get a handle on impacts and estimating mortalities. I also help with some of the algae sampling and water quality testing that occurs in some cases. And then I also help facilitate the collection of fish and wildlife carcasses for sampling when there are fresh ones available. I also have some money and I help provide funding for some of those fish and wildlife related cases for both cyanobacteria testing and also necropsies that may occur. Fish and Wildlife, or CDFW, my agency, has a lab that does some necropsies as well. So that's really useful for our investigations because it can help test for diseases that may be occurring in those fish and wildlife that aren't necessarily HAB related. And so it helps us eliminate other things that are going on in the community. Also, they can test for various chemical contaminants or pesticides, that kind of thing. So that can really help with our investigations and ruling out when cases are not HAB related and are caused by other things. I also can help consult on safe handling of carcasses and disposal of carcasses, especially in large scale events. I sometimes do that. And I also can coordinate with lots of other folks, as all of us do in this work group, federal, state agencies, like, the U.S. Department of Fish and Wildlife and various tribal entities that are helping with us with these investigations all the time. So we have lots of partnerships. Yeah, some resources that I thought you all would be interested in. We do have a website that's linked there. We also have our wildlife health laboratory that does those necropsies that I was talking about. And also the fish and wildlife mortality reporting form. So that's not just for HAB reports or related fish and wildlife mortalities. Any fish and wildlife mortality can be reported there, and then they direct it to the correct entity. So thanks so much for the opportunity.
Yeah, no, thank you. I appreciate everyone coming today. So just to finish this off, you probably heard that there's a lot of expertise in this group. And so if tribes end up having an illness and they want some help and support with that, they can always send an online report to us through our online reporting system. And that'll trigger a response for this group where they can reach out and help assist you. Or alternatively, if you have an interest in setting up kind of your own internal illness investigations group, we'd be happy to provide some support as to what questions we ask or what kind of analyses we recommend and things of that nature. So we're a resource for you in whatever capacity we can be. Sorry, Anna, I think you're going to change the slide because I think next up we're at questions. I'll let you take it.
No worries, you know it. Yeah, so if all of our presenters can come back on camera for a moment. Does anyone have questions for anyone? We can go back to any of the slides. Okay, I'll kick things off while you're thinking. We all know that resources are limited. So anytime I see someone say that they have funding available for tribes, I want to know more about it. So Thomas, can you talk a little bit about the grant funding that you can provide to folks and what it takes to get just the steps so they can be informed and maybe opt in?
Yeah, I'm happy to share. And also, Becky, if you know any additional information, feel free to chime in. I do want to clarify, So I had mentioned this organization called CalWatch, or this project called CalWatch. And so this is through this organization called Tracking California, which is an Oakland-based public health institute program. And so CalWatch is the California Water Assessment of Toxins for Community Health Project, often shortened to be known as CalWatch. And so presently they're funded through a 5-year project with the CDC, the Center for Disease Control and Prevention's Environmental Health Capacity Program. And so the idea of this organization and grant funding is to essentially, hopefully, provide tribes and generally residents of California just information about the types of harmful algal bloom tracking and public policies and just general communications regarding them. And so presently, it funds a lot of the research regarding Big Valley Band of Pomo Indians and a lot of the work that we do with those folks. But there's I'm sure there's additional mechanisms for the funding to be distributed to other tribes as well. I'm not completely 100% on the financial mechanisms, so I'm happy to reach out to the folks over at Tracking California to help share any additional or disseminate any additional information I can to help best distribute the funding however possible. But I did want to share kind of that context where it's essentially this CalWatch program through Tracking California, and really the intention is to better monitor and bring information to HABs for tribes and for the general California resident.
So thanks for letting me put you on the spot there, Thomas. I saw a hand go up, but my memory's trash. So yes, feel free.
Oh. Hi. Okay. So actually, I want to go back to the drinking water, if I may. In rural California, a lot of times you have people that are not on water systems. And I've been asked recently about concerns in tanks, water tanks, that most people use to store their waters. Oftentimes they come from springs and from underground sources, but sometimes it's not just groundwater. People will take surface water. I've told people that to the best of my understanding, algae blooms are not a concern in tanks, but that if I ever had the opportunity to ask somebody who could confirm that fact, I would ask, because it is something I do get asked. And you guys are the ones to know, because we really do get so much, so many people. Like I'm in the Department of Water Resources water tank program, for example, and we are distributing tanks to many community members in case of drought for emergency water tank storage for personal use and consumption. And that's why this is one of the things that's coming up. I've signed up over 150 community members. Many of them are elders and families of low-income backgrounds. So putting in filtration systems or other things like that is beyond the reach of most people. So I would appreciate any guidance with regards to that. Thank you.
Yeah, that's a really great question. We should all be talking about the ways we store water all the time, right? And so within a tank itself, we're not terribly concerned about the development of cyanobacterial toxins just because there's no sunlight, right? So you won't have the the bacterial communities that you'd have in a water body. That said, if they're getting their water from a well, it's probably not a concern, right? But we know that we do have individual water sources that sometimes do draw from surface water bodies, and that again, or at Clear Lake, we know that there are a lot of individual supplies that draw from that lake, and some work was done a few years back looking at efficacy of those home treatment systems or whether they might be affected by toxins. And the data there was not so encouraging, right? Like I told you that public drinking water systems that run treatment plants, they've got a good chance of removing toxins. The same is not necessarily true if you've just got a, some kind of, package system that somebody slaps on the side of your house or let alone at your sink. So if you have a source like that, there could be cause for concern. Otherwise, if you have a typical, groundwater well that pumps into a tank, polyethylene tank, or, whatever you're able to have at your house, development of algae or cyanobacterial toxins probably isn't so much of an issue. But, if that water sits there for a long time, if it doesn't have any kind of a disinfectant in it, it could promote other types of bacterial growth. And so, we recommend that people pay some attention to the water in the tanks, take a look at it, visually, have your water analyzed every so often, at least for coliform bacteria, nitrate, things that could hurt you in the short term. And there are federal recommendations for private well owners to follow in terms of monitoring. And certainly adding a little bit of chlorine, a little bit of disinfectant, just keeping a small residual of that in a tank is a good way to prevent that type of growth from happening if people are comfortable doing that.
What we get out here commonly, people are more interested in using the food grade hydrogen peroxide as a way of keeping their water in the tanks clean. In this particular program, many of the people are looking at it as a long-term storage. A lot of the people in our community are using ponds as a resource, so you do end up with that. And so the conversation has gone to even, oh, well, if I have a pond and I get the water in the winter and it's not active because it's in the dark, then it's not going to be something to be concerned. And so I just want to get verification that saying, yes, you can use that food grade hydrogen peroxide, which is 30% solution, generally speaking, to treat your water. Is fairly safe, and that, no, you shouldn't just rely on putting your pond water because you got it in the winter in your tank and feel like it'll be safe 8 months later. It's good to, pay attention.
Yeah, water should be looked at as perishable, like a food product. And hydrogen peroxide, I'm not going to make any recommendations there because that's not something that we really look at or evaluate in drinking water treatment, except in really complex advanced oxidation type scenarios. I don't know that it has the efficacy that chlorine does as a persistent residual disinfectant. The other thing to be concerned about is if people are getting water out of ponds that has the potential to have cyanobacterial cells in it in the first place, any of these oxidants, chlorine, hydrogen peroxide, could lyse the cells and actually free toxin to be present in the water. So it's really important to know what kind of water you're starting with and whether it's at any risk of having cyanobacteria.
And then I'd also just like to flag for people watching the recording, Becky from OEHA added 2 reports, just going full circle, that came from CalWatch projects about harmful algal blooms in private drinking water intakes and unregulated drinking water contaminants. And so, Becky, I'd invite you, do you want to give a brief summary of those? But I will be sure to share those links in the backup slides as well, so folks have access to them, because it's along the same lines of this conversation. So I'd love to hear some of your wisdom if you're willing to share.
Sure, and that's partly what Stefan was, I think, referring to. So I wanted to make sure we had the direct
more of a
resources.
first-hand source you can hear about it from.
Yeah. I mean, again, as Thomas led in, these were ones where it was direct household intakes. So someone has a pipe into Clear Lake and then was pulling it into their household systems. And as Stefan mentioned, it could be a lot of different varieties of how they're storing and treating the water, as well as near shore wells within 50 feet of the water. And then for the, I think it's the second publication, we also compared to what he was mentioning, the public water system data that they had I think it was a monitoring order for a certain period of time, so they were providing additional information. So we did a comparison of what that meant for a household level system compared to the public water system pulling over those time periods. So as mentioned, generally, yes, your public water systems with that advanced monitoring and treatment, again, we're able to keep it below the US EPA health advisory, or at least at a non-detect, whereas the public water or the individual household systems, again, some of them actually had intact cyanobacterial cells coming through the taps. So definitely concerns there. And then some of the later work, which were not actually there, was also on, but is on the CalWatch webpage, was more around other constituents that you might see more in wells. So a lot of great resources out of that program. Thank you.
Thanks so much, Becky.
Do any of them have long-term storage awareness information I can provide to my community? I don't mind drafting my own pamphlet, but I would love to be able to hand out long-term storage awareness information for 2,500 gallon or more tank storage for and recommendations about what would be appropriate other than hydrogen peroxide, which keeps coming up. And since you're saying that's not really a recommended treatment, you know?
Yeah, I mean, people have, funny feelings about chlorine. It has protected people from much more harmful outcomes all over the world, and still tends to be what's recommended in lower technology situations. And it's what most of us who work in drinking water have experience with. But I want to be clear, like, my program doesn't make recommendations to private well owners or anybody who's on an individual supply. It's out of our mandate, out of our authority, and so we don't spend time coming up with it. What I will do, as soon as I stop talking, I'm going to see if I can find the US EPA recommendations for people on private water sources, and it's possible they may have developed guidance materials in that direction. So let me see if I can come up with something for you.
I have some of that. I was just wondering if you had further information.
Yeah, no, we tend to point people in that direction.
Okay, great.
They actually have a program. They do the work, and so we see no reason to second guess it.
Okay, great. Thank you.
I will ask Stefan if you can add those resources in the chat again for people that might watch the recording, even though Anira's got all of her ducks in a row and knows all the things already. I want to share those resources more broadly too. Awesome. Any other questions?
I don't.
Oh, you do.
But I do EPA stuff pretty happily.
Great. Any other questions for our team here while we have them all in one spot? Great. Well, this was a really great discussion. Thank you all for being here. If questions come up after today, I'll just note on all of these slides, on the bottom left, there's a link to the California HABs portal where you can find everyone's contact information if you want to reach out to people directly, as well as on the slides, if there's like a general inbox, that what those usually mean is it goes to multiple people at once. So then instead of emailing people directly, you get, like a two-for situation, and you might get responses a little bit faster. Okay, great. So now it's back to me. Oh man, I should be ready for this. So in past trainings, we like to highlight the amazing work of tribes. We've heard many times today and in past trainings that tribes have really been leading the way on FHAB trucking and research and all sorts of coordination and collaboration in California for a really long time. And so since this is a tribally centered training, we like to invite tribes to share that expertise. Also, I'll note that developing this training series, we have a tribal advisory committee that has helped us create slides, send invitations, and really find those experts, their colleagues that we can, elevate their work and hear about their work and learn from them in this space. This time, our tribal advisory committee members wanted us to invite the authors of the paper that's on this slide about traditional tribal subsistence exposure scenarios and risk assessment guidance. And we did our best to invite these principal investigators and co-authors and things like that, but they were unable to join us today. So I'm going to try and give a high-level view of why our tribal advisory committee wanted to share this resource with you in hopes that you can check it out later. And for folks that know more about this resource, please chime in if you use it or your favorite pieces of it and things like that. One thing I'll note that we heard in our communications with the co-authors is this is an older manual. I don't know how old, I can't remember the date, but as you can see through the table of contents, there's specific examples from tribes that have kind of walked through the human health risk assessment and exposure scenarios specific to that tribal experience. And, you know, as in previous trainings, we've talked about tribal beneficial uses, and that process with the water boards and understanding tribal exposures can really help inform not just that process in protecting water bodies from a water board's perspective, but also your own public health protection. So some things that we wanted to highlight was, you know, conventional exposure scenarios tend to be based on urban or suburban lifestyles. They might be a little bit more simplistic than the potential exposure scenarios of tribal members living their culture, right? And so the example on the left is a figure from the guidance of a simplified exposure scenario that, you know, traditional or conventional exposure scenarios might use to develop equations and all that stuff. Whereas the indigenous exposure scenario on the right is much more nuanced, much more complex, and therefore harder to calculate because you need more information, right? And so the user manual kind of gives a bunch of different examples of indigenous exposure scenarios that other folks that are interested in doing this sort of detailed work for their tribe might be interested in. I like to say reusing and remixing and applying to your own work. Something that I also really liked going through the manual as a novice myself was the detailed examples of the different tribal exposure pathways, and, you know, really thinking about the ecological, human, and cultural exposures that Native individuals might experience by living their culture and using waters the way that they have traditionally since time immemorial. But then taking those, you know, nuanced exposures and providing examples of not just how to calculate risk, but then how to more meaningfully communicate that risk and how to stay safe while living indigenous practices and protecting tribal public health. So again, not an expert on this, just trying to communicate what our tribal advisory committee thought was really, really important for this audience to know about. Again, there are links on the slide. And I think that was it for my piece. Carly, Marissa, is there anything that I missed that you want to flag for folks here before we move on to questions?
Yeah, Marissa, you're weighing on one thing. Oh, go ahead, Carly.
No, I was going to say, no, go for it.
Yeah. And if you can go back to the previous slide.
Yes, this one.
Yeah. So again, this is a great, depiction of all these different conceptual models of exposure scenarios. And want to tie this back to just take a moment to pull together what we talked about today with the exposure routes. We presented the symptoms, the cytotoxins, that kind of thing. So HAB response plan from our recap, that 8-step response process includes the cyanotoxin trigger levels for recommending action to protect people during recreational water activities. So wading at the shoreline, swimming, watercraft exposure, that kind of thing. And the foundational exposure assessment that informed those trigger levels was based off of studying oral exposure of children swimming. So this is that incidental swallowing or intentional swallowing of water when they're swimming and playing. And so those trigger levels do not comprehensively represent all the exposure pathways that are presented in both of these conceptual models. Just want to highlight that, particularly for tribal cultural uses. We have much more work to do to address the health concerns from contaminated water for all peoples. I just wanted to recognize that, and again, tie it back to the CCHAB trigger levels that we implement currently today as the voluntary statewide network, the voluntary statewide procedures.
Marissa, Carly, what else? What did you want to
Oh,
share?
I was just going to say as well that US EPA actually houses a webpage that has different water quality objectives and thresholds that states and tribes use to be protective. So that might be a good resource to consult, and I can give that to Anna to make sure it's at the end of the presentation, if it's not already on here.
Yeah, drop it in the chat and we'll double check. Any questions about this that are coming up for folks? Have you used this resource before? Is this brand new information?
It's a new resource for me. Mostly
great.
my information comes from the community, so thank you. I really look forward to going through it. Actually, I've been kind of already browsing some of the links.
Yeah, great. Okay, good. We tried for like 4 months to try and get someone present, an expert that helped write the manual to present for us. So we were sad that you're stuck with me today, but we wanted to be sure to share the resource anyway, in lieu of that. Okay, great. Well, if there's nothing else, I know there's a lot of resources being shared in the chat, which is great. Thank you so much, everyone, for doing that legwork for me specifically, so I can share it out with everyone more. We're getting close to wrapping for today. So we wanted to share some additional resources that might support your illness response if you're a tribal organization or a tribal government, and then we'll wrap for today. So I think I'm passing to Carly, who's going to walk us through these.
Yep. Some of these you may have already been introduced to today, but if not, we're just going to reiterate it if it has been. So just a reminder that we do house an online portal to share information both to the public and partner agencies, and it really is our centralized hub that houses all of our guidance and products from interdisciplinary, multi-agency, and tribal network. A lot of the information shared today can be found here. So our HAB map as to current advisories, public health guidance, if folks want to borrow from that, how advisories are communicated in the signage, as well as standardized sample collection and monitoring materials. So, and that remote sensing map that I mentioned earlier. So all of it is right there. So please do go and take a test drive and see what cool stuff you find. It does, and then, yeah, and if there's anything that's missing on there or information that you wish that we would expand upon, please reach out. We are always trying to make it as robust and helpful of a resource for folks as possible. Next slide. So we mentioned our own internal information on how we track and report illnesses in California. So that's also on our HAB portal, specifically this handy fact sheet. So, and then there's also other resources available, including resources for veterinarians and healthcare professionals and providers. So there's a lot of information here just for yourself, or if you want to pass it on to some of the folks that may be treating animals or humans from a HAB exposure so that they're more prepared to know what to look out for. So just wanted to give a quick plug for that. And then as well, and this was mentioned, I think, a little bit more by OEHA and CDPH, but there's more information on marine HABs and illness tracking. It can also be found on the HAB portal as well. There's links to it. So please go and check it out, as well as the handy fact sheet that Shannon mentioned earlier. It's a pretty simple 2-pager that you can even share with others. And it's also in English and Spanish. And then last but not least, the drinking water notification recommendations for the 4 cyanotoxins. I think Shannon or Becky mentioned this, but this was developed by OEHA for our Division of Drinking Water Friends, as well as OEHA developed toxicological summary and suggested action levels for cyanotoxins, and that's a 2012 document, and that can also be found on their webpage. Spoiler alert, we're also working with them to update some of those action levels, so stay tuned. We're still in the beginning stages, but we're hoping to maybe update that with some of the newest science, as well as resources on the US EPA and CDC webpage. And then I know that after this presentation, I believe that Anna's going to be putting a few more resources on here from things we talked about today. So definitely go back and consult it, because there'll probably be some new fun things on there. Next slide. this is just a shameless plug again about the training series itself. So we are now concluding the third of our training series. We have 2 more slated for April and May. We encourage you to come and join us. They're going to be a similar format as today, where we provide some information. We're going to have a tribal highlight that has already been secured. So there will be someone attending us from the tribal community. And we're going to be focusing at the next one on FHAB monitoring design and an intro to data quality and management. And then ending in May before the HAB season to really dial folks in on sample collection protocols and processing of samples, so folks have some confidence in getting out in the field and doing some of that sample collection themselves. And then finishing up in the fall and early winter, talking about that data analysis and interpretation, and then how to use that data to inform mitigation research and additional case studies.
Yeah, thanks, Carly. I just also want to note that the training series webpage is linked on the bottom of this slide. And I forgot to link the recordings to the page. I will fix that before I PDF this and make it public. But the recording and the slides are available for both the January and February trainings. And I'm going to work on getting all of those things up for this training in the next week or so. And so anyone that registered for this training, you'll be the first to know when those things are available. You'll get those links directly in your inbox, as well as a link to the registration for the April training. So really thinking about, before you do your response, before you go out in the field, if you're thinking about doing a more robust FHAB program, like what are the things that we think about from our perspective when we think before we go out and monitor, and some like tips and tricks to think about for data quality and management to make sure that when the data comes back from the field or the lab, that it's useful for you and your needs, whatever those may be. So the registration for that is up. We will have the registration link for May very soon, working with our partners to select a date in the next couple of weeks. So we'll let people know when that's available as well. And yeah, so I will add all of the goodies that we shared collectively in the chat during the training to this slide. I suspect it's going to take a couple because there's a lot of good stuff in the chat that I want to make sure we capture. So if the link isn't already provided somewhere else in the slide deck, they'll be added here as well. And with that, we again are ending early today. I don't think anyone's upset about that. Thanks so much for hanging in with us today. I know that blocking off this time and attending these trainings live is a commitment. And so we appreciate your time and attention. If you're watching the recording, same goes to you, because even though you didn't get to talk to us, you're still here. So we appreciate you as well. Thanks so much, everyone. Have a great afternoon, and we will see you next time.